So most patients come in the morning. You can have a breakfast. You don't have to fast, which is one of the nice things. We recommend you come in well hydrated. And then basically you come in with your bag of medications. So these medications are more like Valium, Halcyon, just to give you a little bit of a little shot of vodka just to relieve any anxiety before you walk into the room. Now that's optional. I have a lot of patients who didn't want any of that and they just go in the room and we just inject the local and they're fine with that. But most patients are a little nervous and then they could use the little extra help. So we still put an IV in, we still give you IV antibiotics before you walk into the room. Then when we bring you into the room, I have some YouTube videos demonstrating this, but you're lying flat on your back, just your breasts are exposed. And so most commonly I do this through a small incision underneath the breast. So I inject local medication there, which feels like a small little bee sting, very tolerable. And then I make a nick in the skin, which you don't feel. And then basically I flood the breast in the whole area I want to be underneath the muscle. And that takes about 2 minutes to do each side. Now during that time, you do feel a few pinches here or there, but it's very tolerable and minimal pain. And then I give you a 10-minute break for that to kick in. And we're talking the whole time, but there's a sheet in front of us. And then after those 10 minutes, I start, and what I'm doing nothing different really than if you're completely under anesthesia. The only difference is it doesn't take away the pulling, tugging, and pressure. So you will feel some pulling, tugging, and pressure, but nothing sharp. So I create the area, and then I put what's called a sizer in, or a balloon, to expand the area to the size we want it to be. And during that part, once the balloon's expanded, I expand it a little bit larger to accommodate the size of the implant. With that, you do feel some pressure discomfort. It's kind of like you're laying down, I'm leaning on your chest a little bit. Some pressure discomfort, but very tolerable. And then we take those out, put the implants in. Since we made it a little bit larger, you don't feel that part. And then we stitch you closed. And because you're numb, you don't feel that part. So the operation takes me in and out of the room, usually 1 hour to 1 hour and 15 minutes. And in the recovery room, the wonderful thing is we don't have to wait for you to wake up because you're awake. You know? And I'm talking to you through the whole time, giving you discharge instructions. I find giving discharge instructions again during the procedure makes better outcomes because people remember them more because they're clear-headed when we discuss these things during your operation while I'm putting your implants in.